Hormonal imbalance and infertility in women. How do hormones cause infertility in women, and which hormones are involved? A lot of women around the world are not able to get pregnant because of hormonal imbalance. Sometimes their hormones are too high, sometimes they are too low. Good day everyone, and welcome to my channel. I'm a seasoned and certified medical microbiologist. My name is Gwendolyn Hale. I'm popularly known as the medical professional with the difference, because I bring you knowledge to your doorstep. I bring you knowledge in the comfort of your living room like no other. If you're a returning subscriber, this is me saying thank you, I love you, and God bless you. And if you just joined this channel, God bless you. Do subscribe, do share the content so that everyone will be empowered. Let's roll in. Welcome back. Into this class, we are going to be talking about hormonal imbalance and infertility in females. This is a very common problem amongst a lot of women. So we are going to go down into it and dig and bring out all the information in detail. Now, what is a hormone? A hormone is a substance that is secreted by the body to carry out a particular function or activity in the human body. And in this case, we are talking about hormones that are related to the reproductive or the sexual organ. Now, that is being triggered by the pituitary in the head. It is important to note that if this hormone, or if any hormone in the body is being secreted in high quantities or in low quantities, there is going to be a problem with the normal functioning of that organ or the normal functioning of that activity. So we'll start with the first hormone that is very important, and that is the follicle stimulating hormone. Now, what is a follicle? We're talking about follicle, we're talking about eggs. And the follicle stimulating hormone is responsible for the growth, for the maturation, for the release of the egg from the ovary. So they are very important. So if there's excess secretion of the follicle stimulating hormone or low levels of the follicle stimulating hormone, there's going to be a problem. The low levels of the follicle stimulating hormones would cause the eggs to be immature, they won't grow, and they will not be released. And when the eggs are immature and they have not grown well and they have not been released, thus fertilization cannot take place. The second hormone that is involved, or very important to get a woman pregnant, is the luteinizing hormone. The luteinizing hormone is responsible for the movement of the egg, the released egg, into the uterus. Now, if there are low levels of luteinizing hormone being released, that means the egg will not move into the uterus. It will not move to be implanted in the uterus, and thus fertilization will not occur. And if the sperms have to meet the egg in the fallopian tube and actually fertilize the egg in the fallopian tube, if conception or fertilization takes place there, that will cause ectopic pregnancy. And we know how dangerous ectopic pregnancy is. After 2-3 months of growth, that fallopian tube will rupture and it will be causing the woman a lot of pain, and she will need immediate surgery to take out that fallopian tube and that ovary. So that means that the lady will only have one fallopian tube that will be functioning, but she will still be able to get pregnant with one fallopian tube. The luteinizing hormone is very, very important. This is the hormone that is responsible for ovulation. So imagine if you have low levels of luteinizing hormone, you will not be ovulating. In fact, that's what we call medically anovulation. So that is how important the luteinizing hormone is to a woman's reproductive health. The next hormone is estrogen. Estrogen is so important when it comes to sexual health. In fact, It is actually what gives the woman the anxiety, to want to have sex with her partner. It actually aids to increase the woman's libido, to make a woman, to prepare a woman's vagina, and it also prepares the uterus for the egg to come and implant there, for pregnancies to start. It actually thickens the walls of the uterus while preparing for the egg to travel down the fallopian tube and implant itself in the uterus. Also, the estrogen is very important in getting the vagina wet. So if you have low levels of estrogen, you'll be experiencing vaginal dryness. The next hormone is progesterone. Progesterone is the babysitter of the pregnancy. That means it takes care of the pregnancy from the zygote to fetus. In fact, it actually keeps the pregnancy from coming out. It actually prevents miscarriages. So if you have low levels of progesterone, you are going to have miscarriages. So this is how important progesterone is to a woman, especially when she's thinking of having kids. The next hormone is prolactin. Prolactin is actually the hormone responsible for the secretion of breast milk. And this is kick-started, as I mentioned earlier, from the pituitary. So imagine if too much prolactin is being secreted. If too much prolactin is being secreted, it may actually reduce the levels of progesterone and estrogen in the body. And this may cause infertility in women. If the levels of prolactin are low, that means breast milk secretion will be low. So when you go to the hospital, the doctor is going to do a fertility hormone assay test. And this test is to actually test all the hormones, the level or the quantity of the hormones that are all responsible for pregnancy or for fertility. That is the follicle stimulating hormone, the luteinizing hormone, estrogen, progesterone, prolactin, androgen hormones, and these are particularly testosterone, because actually high levels of testosterone would prevent a woman from having kids. And also the anti-Mullerian hormonal test. This is to also check how many eggs the woman has left in her system. So after these tests have been done, the doctor will be able to determine the cause of you not being able to get pregnant. And that is where treatment comes in. There are so many drugs on the market to help you, so it's not going to be a problem. This is something I want to advise you on. Going into hormonal therapy of any sort is not a child's play. It's something that you need to be mentally prepared. You need to be disciplined to see it through. I'm saying this because some people start hormonal therapy, and because of the side effects, they put down the drug and they continue with their lives. I'm giving an example. If you're taking either bromocriptine or cabergoline to actually shrink the tumor or the growth on your pituitary, that may be causing a high production, a high secretion of prolactin or other hormones. Trust me, it's no joke. It's no child's play. You need to be able to take out some time and actually get yourself treated and follow the doctor's prescription and take it for the length of time that the doctor has told you to take it for. So with that said, I hope that this video has helped you to be informed, to have knowledge on which hormone is very important, and when you go to see your doctors and when you are sitting in front of a doctor, you can ask questions relating your hormones, because a lot of we females don't know which hormone is responsible for what activity in our bodies. So when you have basic knowledge on your hormones, on certain things about your hormones, certain facts about your hormones, functions about your hormones, it's very easy, it's much easier for you to communicate with your doctor and get right information that may also help you, so that you can also help others. So thank you very much for joining me in this short class, and I hope that you will be able to get all the help that you need from your medical professional wherever you are, because there are so many treatments now on the market to help ladies with hormonal imbalance. And let me say this, let no medical professional talk you into having a child out of wedlock just because you're having an hormonal imbalance. A woman is fertile right up to menopause. Until you reach menopause, you are still very fertile. Although you may have fewer eggs, but you still are going to get pregnant. Thank you so much for joining me into this class. I remain your seasoned and certified medical professional, Gwendolyn Halle. Bye-bye.